Hello everyone, welcome back to our Impact Your Life channel and episode 14 in our pregnancy and postpartum series. My name is Christie Amundson. I am 33 weeks pregnant this week, and today we are talking about upper back and shoulder pain in pregnancy. So what causes this to happen? If you've watched any of my previous episodes, you've heard me talk a lot already about the different hormones that get released during pregnancy to allow for the baby to pass more easily through the birth canal. The main hormone that acts to loosen up those joints in your pelvis as well as everywhere else in your body is called relaxin. And that hormone can also kind of wreak havoc on other joints in your spine because it is not specific, unfortunately, to your pelvis in the areas that need to stretch for your baby. It just affects your entire body. So you do get some laxity in your shoulders as well as in your spine. Also, during pregnancy, as you know, we have to, especially after 20 weeks, your options get pretty limited for sleeping. So most of the time you're gonna wanna be sleeping on your sides, although you can sleep on your back if you're elevated at a 30-degree angle. But a lot of times the lack of options for sleeping, so for those of us who either like to sleep in positions other than your side, or for those of us who like to sleep in various positions throughout the night, you have much less options during pregnancy. It's left or right side lying, and that can often put a lot of pressure on your shoulders and cause more of that instability issues in your shoulders during pregnancy and the postpartum period. Thirdly, we have the center of gravity changes that are going to act upon your spine and change kind of the curvature issues in your spine. So what I mean by that is as your belly grows larger, your center of gravity is kind of displaced more forward. So we talk a lot about this in episode 3, but it's going to pull on your back, and normally your spine is kind of an S shape. So you have a natural curve in your lower back, curve in, and then a natural curve out in your upper back, and it's supposed to kind of be this S shape. However, when one side of that curve gets larger, the other side has to also get larger to balance so that you don't fall backwards or forwards. So when pregnancy pulls our center of gravity forward and pulls our back into more of a pronouncing the arch, it will also, to compensate, your upper back will curve forward a little bit more to compensate for that as well. So that can be a lot, it can cause some issues in the upper back for stability and some increased pressure on the joints and the discs and the muscles. And lastly, we have, in addition to our growing bellies, we have other body changes, including our breasts get larger and heavier during pregnancy, and the weight of that can cause a lot more pulling, which makes your upper back have to work harder to hold up in a better posture. So that can be more fatiguing and more painful and sore in your upper back as your pregnancy goes on and as you gain more weight and the pregnancy progresses, and as well as in the postpartum period. Unfortunately, upper back pain is one of those things that tends to not go away swiftly right after pregnancy or delivery. It is something that hangs around usually because when your breasts fill with milk, whether you're breastfeeding or not, they get really engorged and heavy. And obviously if you're nursing or breastfeeding, that will last longer for you, but you have that problem of the heaviness in the front here, as well as you're lifting and carrying and bending an infant, with an infant a lot more. So there's just more demand on your upper back after delivery too. So first, we're going to talk about some sleeping positional changes. So like I said, you have less options for sleeping when you're pregnant, and check out episode 2 for sleeping positions if you're looking for more specific sleeping positions. But what I wanted to address here is, because it's sometimes difficult when you're sleeping on your side, on your shoulders in particular, what I would recommend is having some pillows. So if you're lying down on your side, either side, first of all, if you have only one shoulder that hurts, it's often better to have that be the top shoulder and not the one that you're lying on. And for the top shoulder, you can fold the pillow under your arm like this, or you can hug it in the front like this, whichever is more comfortable. Now, if you have both shoulders that hurt, or if you just can't tolerate always lying on one side, the bottom shoulder, instead of being perpendicular to the bed, what you would generally want to do is kind of pull your arm underneath you a little bit so that you're more lying on your shoulder blade in the back as opposed to directly on top of your shoulder joint. If you're laying with your weight directly on top, it tends to put more pressure on those ligaments to stabilize, which aren't doing a very good job during pregnancy. The one caveat I would say for when you're laying on your shoulder blade is you want to be careful that you have some support in the back here when you're doing that. So you would want a pregnancy pillow or a bunch of pillows in the back here. This would not be enough because the tendency for your body to want to, when you're sleeping, roll back on your back is more so if you're on your shoulder blade because you're already kind of halfway there. So you'd want something supporting your back that kind of sandwiches you so that you stay up on your side and you don't transition to your back while you're sleeping. So those are the main things that I would recommend for shoulders. Now, if this is still intolerable and you're not able to sleep, again, you can check out episode 2. We talk about sleeping on a wedge on your back. You can either get a wedge from a department store, or if you have like a recliner at home, or you can just use a lot of pillows. You just got to make sure that you're elevating yourself to at least 30 degrees or more. And try 30 degrees. Sometimes that just doesn't feel like enough. So if you still feel kind of like short of breath when you're lying there or dizzy, then you may need to prop yourself up even more when you're lying on your back. So obviously lying on your back is more comfortable for your shoulders. So then when you're postpartum and you can sleep in any position again, then you would probably want to lie on your back, put a pillow underneath your knees, and also you can put pillows, so I'm going to demo this quickly, but you can put pillows like this if it's both shoulders. And that will help support your shoulder a little bit more as opposed to just having it lay flat on the bed. Okay, so I also wanted to show you various stretches and some exercises that you can do for your upper back pain or shoulder pain. Remember, like we talked about with that postural alignment or the postural curvature that I talked about earlier, anything that kind of pulls your lower back into more of an arch is also going to make your upper back have to compensate forward with that curve even more. So you would want to try to avoid any exercise that, or stretch for that matter, that really arches your lower back. So a common stretch that we think kind of feels good would be like stretching back like this. But again, even though my upper back right now in this stretch is stretching back, you can see that that's actually increasing my lower back curve so that when I come out of the stretch, it's actually going to, my upper back will have to compensate even more. So that would be not something that I would recommend, but I'm going to give you some other options in place of that. You can also refer to episode 3. We talk a lot about low back pain, and almost the entire episode is dedicated to trying to decrease the arch in your lower back, which again in turn will decrease the compensation that your upper back has to do as well. So if some of these things that we talk about today are helpful or maybe aren't helpful, I would check out episode 3 and try some of that stuff too. All right, so I'm going to show you a couple stretches and exercises that I would recommend in place of that. Okay, so the first thing I'm going to show you is probably my favorite thing to do because it's just really easy to do. So you could do it while you're at work or at home, and it's just quick and easy. You don't have to go find a place to do a stretch or an exercise. You don't have to lie down. You can do it in a chair. You just want a chair with a back on it. And you're going to sit back in the chair and push your lower back into the chair, because again, we don't want your lower back to arch forward. We want it to actually kind of push into your chair, and that's going to engage your abdominals a little bit, but I don't want you to be a maximal contraction, because again, your abdominals are kind of overstretched, so we want to be gentle with them. You're going to take one hand and reach it kind of down. So as I reach it forward and down, I'm going to drop that shoulder on that side, and then the other hand is now going to go back. So this would be instead of doing this kind of a stretch where your whole back is arching, including your lower back. Now I'm doing a one-sided where I get to pull back and stretch. And when I pull back and stretch, I'm also reaching down. So as I pull back, this shoulder, you can see is kind of, it's like my chest right here is opening up and my shoulder blade is pulling back. So I should feel the muscle in my shoulder blade back here kind of working a little bit and pulling. And I may feel a stretch anywhere through here. And you try to keep your head looking straight ahead, not looking at a camera. And as I do this, I can just hold it for a couple breaths. So again, the goal is to keep your lower back into the chair, keep this arm reaching forward and down so I keep that abdominal on, and then my lower shoulder blade is working to pull open, to stretch open this, and it helps to keep my posture a little bit more upright and stretch. What I would not want to do is, number one, I would not want to be arching my back as I did it. So again, keep your back into the chair. And I also, from a shoulder perspective, don't want, as I bring my arm back, if you watch my shoulder, I do not want to do this, where my arm is going back, but now you can see my shoulder is going actually forward. So I want it to feel like I'm opening from here in my chest as I do it. And I'm gonna hold and breathe. And again, I can do the other side. Push my back in, reach down and forward, go to the other side. And you can hold it for a few breaths. You can hold it for a minute. It's supposed to be a nice stretch for here, and it also turns on those lower shoulder blades that help to hold up your posture and take the pressure off of both of your upper back and get your shoulder in a little bit better position. So I like this much better than your traditional, what you kind of want to feel like you want to do, which is, do this kind of a thing. So just do it one-sided instead, so that you can keep your lower back out of the mix. If you're looking for some posture recommendations, check out episode 3. Like I said, with the low back episode, low back pain episode, we talk a lot about sitting and standing posture to try to keep your low back kind of against the chair to avoid increasing that arch, because again, that increasing that arch in your low back will in turn increase the arch up here to have to compensate, which of course we don't want from a postural standpoint or from a pain standpoint. So next I'm going to show you a stretch you can do that's pretty easy at any kind of sink, or you can do it at a bathroom, rails, or anything like that. I'm at the sink now to show you a stretch for your upper back, and you can do this at a sink, or you can do it at, if you have any handicap rails, either in public restrooms or in your home, or any kind of a stair banister, deck banister that is sturdy. You're going to put your fingertips in the sink, point your toes straight forward, and you're going to lean back and kind of round your back. So it's like you're kind of trying to kind of curve around your baby. So you're going in that big C shape and tucking your pelvis or butt underneath you as you put your weight in your heels and sink all the way back. And then as you're here, you're going to hold here as you breathe. And you should feel an expansion or a stretch through that upper back region. Obviously, if it's painful, then you're just not going to lean back as much. If you're feeling this is pulling you too much on your shoulders, then I would avoid doing this stretch. You will notice that this stretch does pull me into more of a curve, which unlike some of the other stretches that are stretching back. However, sometimes after your muscles have been trying so hard to hold your body up in your posture, doing this kind of stretch and allowing them to just get a break and expand can feel really good. So inhale all the way out. And again, you can hold it for 4 or 5 breaths for about a minute or however long you have. But it can really feel good on that upper back region, trying to give it kind of a break. The next stretch I'm going to show you is lying on your side. So you want to be in a comfortable position on your side. So make sure that the pillow under your head supports your neck well, and you'll probably want something between your knees. So when you lie on your side, similar to what we already talked about with your sleeping position, if the shoulder that you're lying on is uncomfortable to lie directly on top of, you're going to pull your arm a little bit underneath you so that you're more lying on your shoulder blade. Then what you're going to do is you're going to bend your knees up enough that this bottom hand can reach your thigh or reach your knee. And what you're going to do is you're going to push the bottom hand gently into your thigh and vice versa. And that is going to engage a little bit, again, of those abdominals to make sure that your back is not falling into an arch with this exercise or stretch. And then what you're going to do with your top arm is you're going to make circles. So as I go back here, I want my chest, again, to kind of open up and my torso, upper torso, to roll backward. But remember, I'm still pushing my bottom hand into my thigh. And then I'm going to go around. And you may find a spot in the range that you feel a really good stretch. And if you want, you can hold it there for a few seconds. Breathe. And again, you can go both directions with this. So going back this way as well. The key to this is twofold. Number one, that you're making sure you keep a slight pressure with that bottom hand so your abdominals stay on. And that the top hand or the top arm you're allowing yourself to roll backward as you do this. So again, the stretch should feel like it's kind of across maybe the front of your shoulder and your chest and maybe a little into your neck. And you might feel the shoulder blade working. You should not feel neck pain with this. And you should also not feel shoulder pain with this. What we don't want to see is if you're rolled like this and you just move your arm in a circle and you're not rolling with your torso, and you can see how that's really bending my shoulder a lot, that would not be desirable. So we would want this, not this. So again, you can do both sides, both directions. And it's a really nice stretch. Again, for the front, it helps to pull your shoulder blades back to help with posture. It helps to mobilize your shoulder blade around, as well as your middle back around. So this can help with shoulder or upper back pain. But I would make sure that obviously any of these exercises or stretches you should not perform if you're hurting while you're doing them. So if you can't kind of modify to the point where they are not painful, then I would avoid and try something different. Also, if you're looking for a certain exercise to help strengthen, in particular, you would want to strengthen your lower trap muscle, which is the lower shoulder blade muscle here. Check out episode 4 on upper body weight training. There's an exercise in that in particular that's sitting with the band that you're pulling back. You can do both at the same time or one or the other. And that would be my favorite exercise for strengthening for the lower trap. Again, that muscle will help hold your posture better and help kind of counteract a lot of the weight that you're and pressure that you're gaining, especially through as your breasts enlarge, and help hold up your posture and help train that muscle. All right, so now I'm going to show you if none of these exercises seem to be getting at the spot that you're kind of wanting to. There is a certain, if you have a very pinpoint area of pain that you have, you can do something that's a little bit more direct to certain areas in your upper back in particular that can help release the tension there. So I'll show you that next.
Okay, so if some of these exercises or stretches aren't working for you, or if you have certain pain in your upper back that's more of like a pinpoint pain, like a trigger point, as in you could take your finger and point to the exact area as opposed to, kind of my whole upper back is sore. A lot of times you can do your very own trigger point massage by, if you grab, this is just a lacrosse ball, you can get a trigger ball like these, or you can get you can use a tennis ball, or you can use, if you have one of these like nice Theracanes, you can use that. You can do it as sitting, you can do it standing up against a wall, or you can do it lying down. Obviously, if you're pregnant, you'd be lying down on your back on a wedge elevated at least 30 degrees or more. But you would put the ball kind of right in the spot that you're feeling and then lean up against the chair. And the biggest thing when you're doing this, and you can kind of rock back and forth on that spot, but the biggest thing is you want to leave a sustained amount of pressure, and you want the pressure to be enough that you can just breathe through it and kind of sink your body into the ball, but not so much that you're, grinning and bearing it, because obviously if your muscles are kind of tightening all around it, it's not going to release very well. So you want to be able to breathe and kind of sink into that. And again, you're going to hold it, and you can hold it for about a minute. Usually, or oftentimes you will feel it kind of like the pain or the tension kind of melt away a little bit. And that's when you can kind of move. And again, some people can use this all over their back in fine kind of sore spots or trigger spots in their back or shoulder blade region that this can help with. You do want something firm enough that it's going to give you some pressure. So if it's something like a real squishy ball, it's not going to work. The Theracane, you would wrap it around, and there's different versions of this, but again, you put the ball right where you want it, and then you can use your hands, and you're basically pushing forward. And the nice part about the Theracane is obviously you don't have to have a surface that you're going into. You could do this at your desk, and some people like to do this up in their kind of like upper neck region here too, which is much harder to get with a ball. Obviously, to try to get that against the wall or a chair is more challenging. So again, you're just going to hold and breathe. The biggest mistake people make when they are doing any kind of trigger point or self-trigger point work is that they usually tend to push too hard or have it be really painful, and it's kind of like no pain, no gain kind of mentality. Your body does have a threshold where if you're trying to stretch or release tension, it will only, it has a protective mechanism. So if you push really hard on something, your body will automatically have this kind of spasm back response that it's supposed to do. It's supposed to protect your body from injury. So if you're jamming in so hard that you're hitting that response, then you're not going to get any release very well because your body is trying to protect itself. So you want to push enough that you can feel it, but not so much that you're hitting that response. And usually if you're hitting that response if you can't breathe through it, or if after you do this, it feels tighter or more sore than before you did it, that usually means then you hit that response and you would want to back off. So, like we talked about before, upper back pain especially is something that doesn't typically
melt away right after your delivery or initially in the postpartum period. It usually lingers. It's one of the symptoms that lingers the longest because especially in nursing mothers, or if you're not nursing, anybody that's not used to, like first-time moms, or not used to holding, lifting, carrying, you know, this 8 to 10 pound infant around, a lot of times your muscles just aren't used to that and they need to get accustomed to that. So it is something that you're going to want to, you may want to keep these recommendations, these stretches or exercises in your regimen for a little while until that dissipates, and or seek, if it's not dissipating, I would definitely contact your medical provider and talk to them about your options, seeing a physical or occupational therapist perhaps, and getting more individualized treatment and options for you, because you should not have to live with it. So I hope that some of this stuff in this video was helpful to you, and please, if it was, give us a thumbs up, subscribe to the channel so that you get, and hit the bell icon so that you get more notifications for our weekly updates, and we will see you next week. Take care.